This portion of New Day Northwest is sponsored by Snohomish Health District.
Welcome back to the show. You know, with COVID variants making headlines again, it's a good reminder that just because things are opening up today, the effort to get people vaccinated continues. So to get an idea of how things are going in Snohomish County, I talked with Dr. Chris Spitters of the Snohomish Health District.
We're currently 5th in the state for the highest COVID-19 vaccine rates. 65% of those 12 and up in Snohomish County have started vaccination. And that means about 460,000 people, and 400,000 of those have gotten their second dose. But we still have 200 to 250,000 people who haven't started vaccine yet, even though they're eligible. And so we still have more work to do there.
So I remember when I was looking for my vaccine, there was still I didn't know where to go. What should people do who haven't been vaccinated but are still looking to get there?
Most pharmacies and many healthcare providers are offering vaccines. Many places also allow walk-up vaccines without an appointment. And for more information about where to get vaccinated, you can check with your personal healthcare provider, or you can go to our website, snohd.org, and click on the COVID vaccine button. And there's more information about different healthcare system providers in the county who are providing vaccine. And last, don't forget your local community pharmacy. Most of the major chains have sites throughout the county that are offering vaccine as well.
There are some people, though, who are they don't want to get vaccinated. My grandmother, she still hasn't been vaccinated. She's still on the fence. What can I tell her? She's not in Snohomish, by the way.
Well, we certainly have people who are sitting on the fence here as well. And, that's understandable. There's, many people have a variety of feelings about vaccines in general, or this vaccine. Some people are afraid of needles. For some people, it's a matter of convenience or availability. There's a lot of reasons that people are on the fence. What I can say is that right now, this vaccine is the best line of defense we have against COVID. It's an effective and safe vaccine. And the majority of our current cases are hospitalizations and deaths are among unvaccinated individuals. And getting vaccinated is the best way to prevent from getting sick, ending up hospitalized, or having a serious illness due to this. There's also another thing to avoid is there's growing research about long-term health impacts, persistent symptoms, long COVID as it's called. Other things to keep in mind is there are people in our community who, kids under 12, they can't get vaccinated yet. Some people have medical conditions where they've not gotten vaccinated, or they've gotten vaccinated, but the vaccine isn't as effective in them because they're immunosuppressed. And so by as many of us getting vaccinated as possible, we can also protect those people and prevent the emergence of these variants that we're hearing more about over the course of time. So for folks who have concerns about their safety or the effectiveness of the vaccine, we encourage them to consult reliable resources like the State Department of Health, the Health District, CDC, and above all, talk to their own personal health care provider about it.
I know some people also are curious about kids getting vaccinated. Now, vaccines are available for kids 12 and up. What do parents need to know about that?
Well, again, first and foremost, the vaccine is safe and effective in adolescents and young adults, and it's currently authorized for use down to age 12 with the Pfizer product. It's important to remember when we look at, what age groups are getting the most have the highest rates, it's really young adults and adolescents over the course of the pandemic. And because they're young and moving around in society, they're at higher risk to pick it up, and they're also at higher risk to spread it to others, whether that's other people their own age or worse, vulnerable people. So it not only going to protect their health and prevent those kind of long COVID syndromes in them, but also protect the rest of the community.
All right. Anything else you'd like to share with parents before we let you go?
Now is a good time for parents to make an appointment for their child's annual well child visit, we call it in medicine. And that's not only for catching up on vaccines. If they're 12 and older, they can get the COVID vaccine, but also for other aspects of assessing the kids' development, talking with parents about how things are going, and setting up children for health and success with the new school year. So I encourage parents to call their child's healthcare provider and make that appointment now so that it can get done before the fall.
And for more information on the COVID vaccine, you can visit the Snohomish Health District's website. They're right there on your screen.